pharmacies. Licensing is an issue. Some of them do not even know, where these documents should be coming from. At the same time, the issue of stockouts, Mr. Speaker, that has been spoken out. The issue of expired drugs. You wonder why would you receive stocks that are almost to expiry, and then this will be definitely a dead stock. Mr. Speaker, this is, wastage completely. And at times you find that the suppliers force them to receive these stocks, yet the expiry duration is at a very minimal, it's very minimal rather. It is sad, Mr. Speaker, whereby there are issues of conflict of interest. The same staff who are employed in these counties are also running pharmacies just adjacent to the hospital there. And at times, patients have to be sent to buy specific drugs in these particular specific stores, Mr. Speaker, which disadvantages them because the cost of that particular drug, definitely, it's at a higher price compared to the GOK price, Mr. Speaker, which has really disadvantaged a lot of patients. When we walk to hospitals, Mr. Speaker, the first thing is to talk to the patients, get to ask them, have you been given services on time? What are the issues that you're experiencing? Because as representatives of the people, it is our role and mandate to get to engage with the people on the ground, get to ask them the concerns. And this goes very well because some of them are able to voice out. Some will tell you, like a case we found in one of the counties, some will be able to say, you know what, I've been here for the last 3 days because the scanning machine is not working. And when you dig down and get to understand, why is this machine not working? Apparently, sometimes the management is not even aware. They don't know, like, the machine stalled. And the patients are here, they've been in and out, and nothing, consultants cannot be able to progress without the scan report. And it's when up and down the technical people will be moving up and down trying to sort this kind of things, which should have been sorted. Mr. Speaker, before I proceed further, the question is, where is the problem? We have given monies to the counties, Mr. Speaker. They have professional employees, Mr. Speaker, on the ground. Why are we still having this quagmire that we're speaking of today? Because there's no really county that we can give more than 60%. Most of them are below when it comes to matters health. As much as they've really tried, but a lot is so much expected because everything should be about health, Mr. Speaker. You could be good in any other thing, but when your health sector is not working, definitely it will have problems. Issues of stockouts, of reagents, Mr. Speaker, in the laboratories, the challenges of even this staff not being able to have the protective gears that they are supposed to have in order to be able to undertake their roles and mandate are very well. Mr. Speaker, from where I sit, having had a touch of the medical background, I realize that most professionals in the medical space are not used to oversight. And actually oversight from politicians. The first thing is like, what do you know for you to be able to ask me A, B, C, and D? Until we tell them, we are not here for war. We are here to get to understand what are your problems so that we can be able to support you with reality and with facts. For you to be able to say you do not have enough money, even the little that you have, why have you not been able to do improvements? Because we want to support counties. We want to support the health sector that is currently devolved. And so I would want to urge doctors in that profession, anybody in that medical space, in the hospitals, to embrace leaders when they come for oversight, and especially Senate, because we are the oversights of the counties. And our main goal is to try and help the counties be able to have better services to the people. That can only be done when we are able to identify what is the problem, what is the challenge, Mr. Speaker. We've identified a county like makwiny, Mr. Speaker, where there is a shortage for radiologists, Mr. Speaker. And in a nutshell, you realize that there is a shortage of radiologists in this country, Mr. Speaker. And I'd want to encourage the young people studying medicine. Let them try and specialize in radiology because there is huge shortage of these professionals in this country, and there are many opportunities in regards to the the radiologist line, Mr. Speaker. We were able to look at even ambulances, Mr. Speaker. During emergency cases, it's worse. An ambulance is just there, it is told. Someone has to be called, a manager, to be able to, ensure that stocks are also in that particular ambulance and all that. And you find they still have challenges as basic as an ambulance. And where you find that in the parking lot, we have sort of failed and faulty motor vehicles over and over and over years and years and years. And yet these are equipments that, if well maintained, Mr. Speaker, they could be able to serve a majority and a bigger number of people across different and within the regions in place, Mr. Speaker. Mr. Speaker, when we talk about drugs, it is very sad that today in Kenya, we have a shortage of a drug called dexamethasone, Mr. Speaker. A very important and critical drug for mothers, and especially for those on early delivery, Mr. Speaker. And this drug, which should be supplied by GOK, Mr. Speaker, it is one of the cheapest drugs. But when a doctor recommends it, then you are between life and death. And that drug cost only 120 shillings, Mr. Speaker. And we have that shortage, and that is why sometimes you're finding that our women are suffering during delivery period, Mr. Speaker. And yet we come across expired drugs worth millions of money. Where's the priority, Mr. Speaker? These are some of the things that when the President, Dr. William Ruto, says, it's the high time that KEMSA supplies drugs directly to the health centers. I completely, 100% do agree with it. Why? Because from the time you enter a health facility, the reception, administration, records, you go and meet a doctor, you send to the lab, diagnosis is out. What the doctor will do, he or she shall prescribe for you. When you get that prescription, your last place in any health facility is the pharmacy, Mr. Speaker. It is at that point that you're supposed to get your medication. Because without that medication, then you cannot get the treatment. Everything ends up with the medication. And that is why at the pharmacy level, it is a very sensitive place. The professionals who are there, the pharmacists, the farm technologists, are very important people, Mr. Speaker, because they are the final team. They are the final professions who will be able to give you what you need to have for you to be able to get better. And so the discussion of having medicine directly from KEMSA to these institutions is the best thing, Mr. Speaker. We've had rumors here and there, and I would want the Committee of PAC to try and investigate that when they say at times money is transferred from the health facility back to the county, Mr. Speaker. It is sad. Then how are these facilities supposed to independently run their operations, Mr. Speaker? People need to be paid. Drugs need to be bought. Reagents need to be bought, Mr. Speaker. Cleaning need to be done. Food need to be provided for the patients, Mr. Speaker. The other thing, Mr. Speaker, that is so sad, we are in 2025. 90% of our operations, 99, is through the digital platforms. Our manifesto has focused so much on digitalizing government services. We've moved from about 1,000 to over 15,000 services. Back to the hospital, Mr. Speaker. You go to any of the departments in the health facilities, these records are manual. And if they're not manual, if a staff has got a gadget like a computer, either it's a computer that is not working, or if he or she has gone further to acquire a laptop, that laptop belongs to him or her. So after duty, he or she goes with it at home. So what happens now? You find that counties have not really put the priority of digitalizing all their records in all the departments to get to know how to, you know, what is short, what is not short, what needs to be added, what does not need to be added, and things like that, Mr. Speaker. We are in 2025, for Christ's sake. Information should be digital, Mr. Speaker. It's also safe like that, Mr. Speaker. The overcrowding that we've seen, SHA is very clear. The laws that we passed here, Mr. Speaker, are very clear. A hospital bed should only have one patient. It is sad, Mr. Speaker, to find the age of our parents. Imagine 2 men, 70 years and above, Mr. Speaker, on one bed. At times we find mothers, young mothers for that fact, have been blessed with the bundles of joy. 3 mothers at times in one bed with their 3 little ones. How many Kenyans are those? 6 Kenyans. These are things that even when you go to our social media platforms, we've voiced out. It is not stories that we are making. It is reality that is out here, which is completely very sad, Mr. Speaker. Infrastructure maintenance is a problem. These counties now, these hospitals have what we call the FIF fund. They should be able to ensure the standards of these hospitals are up to date, Mr. Speaker. They have the board that is running these hospitals, Mr. Speaker. So it just requires proper management with the little or more resources that they have. Conditional grants have also been given to these hospitals, Mr. Speaker. As I conclude, Mr. Speaker, waste management is another issue. Incinerators, Mr. Speaker, are not to standard. The last visit we did, as much as this report is for Meru and Laikipia, Mr. Speaker, in Kiambu County, it was a shock. And even the management was also shocked. Like, they have heaps and heaps and heaps of waste. And adjacent, we have Kenyans living in their homesteads, just as adjacent across the road, Mr. Speaker. It's very sad. All that is needed is a budget for the incinerator to be able to